7 medical tests that could kill you after 70. And doctors won't tell you this. There's a hidden truth that 99% of seniors will never hear from their doctors. Every year, millions of people over 70 line up at clinics thinking they're staying safe. But what if I told you that some of those routine tests, the ones your doctor says you need, could actually push you toward unnecessary surgeries, strokes, or even cancer? New studies reveal that up to 43% of medical tests in seniors lead to unnecessary treatments, serious complications, or permanent side effects. And most shocking, one of these tests, number 1 on our list, is responsible for 5% of all cancer cases in the United States, the same number caused by drinking alcohol daily. You won't hear this at your clinic, you won't see it on a billboard, but the truth is buried in the science. Have you ever felt pressured to take a test you didn't want? Have you been afraid to question your doctor? Or maybe you know someone who suffered complications from a procedure that seemed simple? Today we're going to discover together what these 7 dangerous tests are and how you can protect yourself. Because your health and your life are too precious to be put at risk by fear or misinformation. Test number 7, bone density scan. It sounds harmless. A quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. But here's what no one tells you. Past the age of 70, a bone density scan can often create more fear than benefit. This scan, officially called a DEXA scan, measures how strong your bones are. It's primarily used to detect osteoporosis. But in older adults, especially women, the results almost always come back showing lower density, even when there's no real danger. That's because bone loss is a natural part of aging. Just like wrinkles or gray hair, it happens to everyone. And yet, many seniors are pushed into taking medications like bisphosphonates, which are supposed to strengthen bones, but come with serious side effects like jaw necrosis, a rare condition where the jawbone starts to die, and severe esophageal irritation. Here's the shocking truth. Studies have shown that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates. A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. That's not nothing, but it's far from life-saving. Instead, those women were far more likely to suffer from medication side effects, including digestive issues, inflammation in the esophagus, and brittle bones that break in odd ways. Let me tell you about Margaret, a 74-year-old retired librarian who was referred for a DEXA scan after her annual checkup. She had never had a fall, no pain, and walked daily. Her scan came back showing osteopenia, which is a mild reduction in bone density that is not considered osteoporosis. Her doctor immediately started her on alendronate, a bisphosphonate. 3 months in, she developed severe reflux and jaw pain. By the time we saw her, she hadn't read a book in weeks because of the discomfort. We took her off the medication, started her on a regimen of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with foods like sardines and leafy greens. A year later, she was back to her daily walks with stronger legs, better balance, and 0 fractures. A bone scan may seem like a smart move, but for people over 70 who aren't falling or breaking bones, the better option is lifestyle. Strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by over 25% according to a 2023 Osteoporosis International study. Don't let a number on a screen scare you into treatment you may not need. But there's one scan that can lead to something even more terrifying. Brain surgery. Let's talk about that next. Test number 6, brain MRI for memory loss. When seniors feel more forgetful or confused, the natural impulse is fear. Fear of dementia, fear of Alzheimer's. So, doctors often respond by ordering a brain MRI. But here's the uncomfortable truth. MRIs, which are detailed scans that show the structure of the brain, rarely give the answers patients are hoping for. In fact, most MRIs in people over 70 simply show age-related changes, which means slight shrinkage or white matter spots that are totally normal in older adults. But here's the kicker. Once those spots are seen, they can trigger a cascade of fear, further tests, and even surgery. Surgery that may not improve memory and can actually make things worse. In 2022, a study published in Neurology Today reviewed over 3,500 MRI scans in patients aged 70 to 85 who had mild cognitive complaints. 89% showed some form of brain abnormality, but only 2% of those findings were linked to an actual treatable condition. That means 98% of people went through the emotional toll of hearing there's something wrong when really there wasn't. Worse, nearly 15% were sent for invasive procedures like spinal taps or even exploratory biopsies, all based on vague scan results that turned out to be meaningless. Take Robert, a 76-year-old retired engineer who came in worried about forgetfulness. He was sharp but misplaced his keys more often and forgot names sometimes. His doctor sent him for an MRI that showed white matter changes. He panicked, convinced he had dementia. He stopped driving, stopped going to his weekly poker game with friends. Over the next few months, his anxiety worsened, and ironically, his memory got worse too because of the stress. But when we reassessed him using a standard cognitive test, his score was well within the normal range for his age. We explained that those MRI findings were age-appropriate, like finding wrinkles on your face. We helped him focus on lifestyle interventions like better sleep, proper hydration, and brain-stimulating activities. Within 3 months, his memory had stabilized and he felt like himself again. He even won his poker game last week. The truth is, unless there are severe neurological symptoms like seizures, sudden personality changes, or rapid functional decline, an MRI is rarely helpful for mild memory loss. A better first step is a cognitive screening test, which is a simple paper-based exam that evaluates memory, attention, and problem-solving. It's cheap, effective, and avoids the risk of unnecessary panic. Now, brace yourself because the next test on this list is one you've probably had multiple times, and it's number 5 for a very dangerous reason. Test number 5, Cardiac Stress Test. It's one of the most common tests given to seniors complaining of mild fatigue, chest tightness, or just not feeling like they used to. The cardiac stress test, which is a procedure that monitors your heart while walking on a treadmill or being given medication that simulates exercise, is meant to spot blocked arteries. But after 70, this test often does more harm than good, especially when used on people who don't have any clear signs of heart disease. That's because it can lead to false alarms and unnecessary heart procedures that carry serious risks. The problem is in the accuracy. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test says there's a problem when there isn't, can be as high as 45%. That leads to follow-up tests like angiograms and even unnecessary stent placement or bypass surgery. In 2023, a major study in JAMA Cardiology found that more than 60% of all stents placed after stress test referrals were done in patients who had no real symptoms or benefit. And those patients had no improvement in survival or quality of life after the procedure. What they did have, however, were higher rates of bleeding, kidney injury from contrast dyes, stroke during the procedure, and prolonged hospital stays. This happened to William, a 77-year-old retired postal worker who stayed active by walking every day. During a checkup, he mentioned he sometimes felt tired on hills. His doctor scheduled a stress test just to be safe. The results were unclear, so he was sent for a catheterization, which is a test that inserts a tube into the arteries to check for blockages. A mild narrowing was found and a stent was placed. But that night, William had a severe reaction to the contrast dye and developed kidney problems. He spent 8 days in the hospital and needed dialysis for weeks. The fatigue never changed because it wasn't a heart problem to begin with. He was simply an older man who needed better hydration and iron levels checked. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, shortness of breath on exertion, or a significant drop in energy during light exercise, then a stress test may do more harm than good. A better option is often a resting EKG, which is a test that looks at the heart's rhythm while you're still, or even a coronary calcium scan, which is a low-radiation imaging test that shows whether dangerous plaque is building up. These are safer, simpler, and far less likely to push you into a procedure you didn't need. But now we're getting to the really dangerous territory. The next 4 tests on our list have sent thousands of seniors into unnecessary treatments, and one of them might shock you. Test number 4, colonoscopy after 75. You probably didn't expect this one, but colonoscopy, which is a procedure that uses a long camera to examine your colon, is not always a wise choice after age 75 unless there are specific symptoms. The risks go up dramatically with age. The preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney issues. The sedation used during the procedure poses added risks to brain function in older adults. And perhaps most surprisingly, the test itself can cause complications like bleeding, tearing, or even heart rhythm disturbances. A 2023 study in JAMA Internal Medicine followed over 1.5 million Medicare patients aged 75 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 1 life was saved, but over 25 people experienced serious complications. That's a 25-to-1 risk-to-benefit ratio. Test number 3, annual comprehensive blood panels. While basic blood work can be helpful, many seniors are subjected to extensive panels testing for dozens of markers that often lead to false alarms. Slightly elevated liver enzymes, borderline kidney function, or minor thyroid variations can trigger cascades of additional testing and unnecessary treatments in people who feel perfectly fine. Test number 2, mammography after 75. The U.S. Preventive Services Task Force now recommends individualized decision-making for mammograms after 75, yet many women are still automatically scheduled. The radiation exposure accumulates over decades, and the likelihood of finding slow-growing cancers that would never cause problems increases significantly. But test number 1 is the most dangerous of all. Test number 1, annual full-body CT scans. Full-body CT scans, which are sometimes offered as part of executive health packages or as preventive services in private clinics, are marketed as a way to catch cancer early. But here's the shocking truth. These scans expose your body to massive doses of ionizing radiation. Each scan delivers between 15 to 25 millisieverts of radiation, which is equal to around 750 chest X-rays. According to a 2024 modeling study published in JAMA Internal Medicine, the rise in CT scans across the United States may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. Let me tell you about Patricia, an active 78-year-old who used to teach yoga to other seniors. She felt great and took part in a premium health screening at a private clinic. Her full body scan showed a tiny 4 mm lung nodule that set off a chain reaction. She was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The result, benign. But the biopsy collapsed part of her lung, leading to hospitalization and a 3-month recovery. All for something that could have been left alone. The American College of Radiology is clear: there's no proven benefit and significant potential for harm from routine full-body scanning. So there you have it. 7 tests that may seem helpful but can actually hurt, especially once you're past 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more. The key is to always ask your doctor 3 critical questions. What happens if this test finds something? What are the risks of the test itself? And what happens if we don't do this test at all? If the answers are unclear, or if the risks are higher than the potential benefits, it may be time to pause and think. Remember, real prevention starts with lifestyle. Stay active with activities you enjoy. Eat nutrient-dense foods. Sleep deeply and manage stress. Choose your medical tests wisely, not out of fear, but based on real symptoms and evidence. Your body has wisdom. Listen to it. You've lived over 70 years, and that experience matters more than any single test result. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences in the comments below. Your story could help save someone else from going through the same thing. If this video opened your eyes to the hidden dangers of overtesting, please hit that like button and subscribe to our channel. We're committed to bringing you the truth about health and aging that you won't hear anywhere else. And don't forget to ring the notification bell so you never miss our latest videos. Because your health, your time, and your peace of mind are too valuable to waste on fear-driven medicine. Thanks for watching, and remember, sometimes the best medicine is no medicine at all.